What causes nocturia and waking up to pee at night? Imagine waking up in the middle of the night feeling like you just can't ignore the urge to go. Nocturia is a common issue that affects many people, especially as they get older. It's when you wake up during the night to urinate, and it can really disrupt your sleep and daily life. But what exactly causes this to happen? Let's explore the main factors behind nocturia and how they relate to bladder health. The most common cause is called nocturnal polyuria. This means your kidneys are producing too much urine during the night, often making up about 80 to 88% of cases. Normally, your body reduces urine production at night thanks to a hormone called antidiuretic hormone, which helps your kidneys hold onto water. When this hormone isn't released properly, or if your body's fluid balance shifts, your kidneys may produce more urine while you sleep. For example, if you have swelling in your legs during the day, lying down can cause that fluid to move into your bloodstream and kidneys, leading to increased urine production at night. Age also plays a role, as kidney function and hormone regulation tend to change over time, making nocturnal polyuria more common in older adults. Another factor is global polyuria, which involves excessive urine production throughout the entire day and night. This can happen if you have uncontrolled diabetes, where high blood sugar levels cause your body to excrete more water through a process called osmotic diuresis. Diabetes insipidus, a rare disorder affecting water balance, can also cause large volumes of dilute urine. Drinking a lot of fluids, especially before bed, can contribute too, as it increases the amount of urine your body needs to process. Bladder issues are also important to consider. If your bladder cannot stretch or hold as much urine as it should, or if you have an overactive bladder, you might feel the urge to urinate more frequently, including during the night. Conditions like overactive bladder syndrome, benign prostatic hyperplasia in men, or neurological problems affecting bladder control can all lead to nocturia. Less commonly, bladder cancer may cause symptoms that include waking up to urinate, but this is usually accompanied by other signs like blood in the urine or pain. Sleep disorders and other health conditions can also cause nocturia. For example, obstructive sleep apnea, where breathing temporarily stops during sleep, can lead to fluid retention and increased urine production. Heart failure and vascular diseases can cause fluid buildup during the day, which shifts into the bloodstream when lying down, prompting the kidneys to produce more urine at night. Mental health issues like depression or chronic pain, as well as neurological conditions such as multiple sclerosis, can disturb sleep patterns and contribute to waking up to pee. Certain medications, especially diuretics taken late in the day, can also increase nighttime urination. Lifestyle factors like drinking caffeine or alcohol close to bedtime can irritate the bladder or increase urine volume, making nocturia more likely. Because nocturia can be caused by so many different factors, it's important to look at the whole picture. It's more common as people age, but it can also be a sign of underlying health issues. For some, it might be manageable with simple changes like adjusting fluid intake or timing medications. For others, medical evaluation might be necessary to identify and treat conditions like diabetes, sleep apnea, or bladder problems. In the context of bladder health and bladder cancer, persistent or worsening nocturia should always be checked by a healthcare professional, especially if it's accompanied by other symptoms like blood in the urine or pain. In summary, waking up at night to pee can stem from increased urine production, bladder capacity issues, or sleep disturbances. It often involves a combination of factors that requiring careful assessment. If you experience frequent or severe nocturia, talking to a healthcare provider can help determine the cause and find the best approach to improve your sleep and bladder health.